Move on to our next opportunistic fungal infection, Mucormycosis. This class of disease is caused primarily by two fungi, Mucor and Rhizopus. We'll primarily focus on Mucor, which is why our scene takes place in the Mu Car Auto Shop. However, since you should remember that Rhizopus is included in this group, we've added the slogan, Rides Are Us. Kinda sounds like Rhizopus, right? So what population is at risk? Well, since we're talking about opportunistic infections, you should remember that this fungus takes advantage of immunocompromised people. To help you remember this, we'll have the customer on the left holding a cane, which stands for immunocompromised patients, specifically patients with leukemia and neutropenia. As you can see, he is also helping himself to a jar of candy on the table, which is supposed to represent diabetes, a symbol that has its origins in the Pseudomonas video. Thus, diabetics are another group affected by these fungi. And lastly, notice the baguette in his arm. What is this supposed to represent? No, not French people. It actually represents itself, bread. Rhizopus is essentially a bread mold. So, yep, baguettes are a susceptible population as well. Poor baguettes. So how is this fungus transmitted? Pretty much like the rest of them, through spore inhalation. Do you remember how we usually symbolize inhalation as a form of transmission? That's right. Usually a character is coughing. So here we have our mechanic in the back coughing because of fumes that are coming out of this exhaust pipe. So after being inhaled, the fungi like to proliferate in the blood vessel walls, especially where there is excess glucose and ketones. Remember how we said that diabetics were susceptible to this fungi? Well, can you imagine a situation where there is a high blood sugar and high ketones? That's right, diabetic ketoacidosis, or DKA. DKA is the most common predisposing factor to this fungus, and this ketotic state will be represented by this sign here, labeled ketone auto parts, which is advertising car products. Now before we move on to clinical presentation, we have to discuss the morphology of the fungus. Unlike its counterpart, Aspergillus, the hyphae on this fungus are going to be non-septate and have wide-angle branching. Wide-angle branching looks like they branch off at 90-degree right angles. This is really important because it's another opportunity for the boards or your professor to test you with an image. So we'll give you a really good visual for this branching. Look at this tire iron that the mechanic's holding, and these that we have pasted on the back of the wall here. Notice how the rods are solid and without any septations and are at 90-degree angles. In fact, this cross-shaped structure is probably the most important test question regarding Mucor. So remember these 90-degree branching and that they're non-septate rods. Alright, on to clinical picture. Recall that I mentioned that the fungus likes to proliferate in blood vessels. We represent blood vessels with red jumper cables. Red cables look a lot like these cars' vasculature. After invading blood vessels, the fungus likes to penetrate the cribriform plate of the skull and enter the brain. If you remember from anatomy what the cribriform plate looked like, you'll hopefully appreciate our symbol. It's essentially a structure in the skull with multiple perforations that allow the passage of olfactory nerve fibers. You can see how easy it is to penetrate a plate that has several holes in it. To remind you of the cribriform plate, we're going to draw our symbol here, this oil pan, that has several holes in it that the oil is leaking through. In this example, think of the fungus as the oil that is crossing the holes and oozing into the brain. It's a nasty little fungus, and after going through the plate, the fungus then continues to proliferate in blood vessels and cause necrosis of tissues. And this is what leads to rhinocerebral mucormycoses and eventually to frontal cortex abscesses. So to illustrate what this disease looks like clinically, we'll draw our mechanic under the car with oil dripping onto his face, specifically around the eyes and nose. This necrotic tissue presents as a black eschar on the face and in the nasal cavity. See how he has these dark splotches on his face? The prognosis at this stage isn't good. If you start developing necrosis of your nasal cavity and eyes, because it spreads so quickly through the blood vessels, it likely means that it's already spread deep into the recesses of the brain, causing neurodeficits and death. In fact, most of the pictures you'll see of rhinocerebral mucormycoses, you'll notice that the patient is on a cold steel table rather than a hospital bed. Not a good thing to have. So what are the treatments for these patients? Well, first, like most necrotic infections, dead tissue needs to be removed via surgical debridement. So don't forget that in your answer choice. On top of that, we need medical therapy. And what is the one antifungal we always use for very serious fungal infections? Amphotericin B. And what is our recurring symbol for this drug? Can you spot it in this picture? It's not obvious, but look at the car. Notice it's green, and the headlights look like eyes? Kinda trippy. It looks like a frog, right? And it's smiling? See it? Maybe? No? Well, the rest of the sketchy team thought I was nuts too, and they didn't trust that anyone else would see this car as a frog. So with their lack of confidence, they went ahead and slapped a custom license plate that says frog lever on the front. Anyway, this giant frog car that may or may not exist is our amphotericin amphibian. And that's about it for Mucor and Rhizopus. Pretty straightforward given its severity. The highest yield facts for this is knowing the wide angle, non-septate branching that makes it look like a tire iron, and that it infects those in DKA, so remember ketone auto parts. With those two factoids drilled into your noggin, you'll be golden.